Hello, everybody. Thank you for being here today. Happy Thursday. We are close to the end of our webinar series. We have a few more to go, but as we approach winter and the holiday season, we'll be wrapping up shortly. But um, as always, we're excited to dive into things today. I'll go ahead and share my screen and we can get started. As a quick introduction, my name is Catherine Martin. I'm a BCBA and enablement lead with Motivity. And today we are going to be talking about data-driven growth. So utilizing some of our dashboards to help make informed decisions. As another introduction, I'll also talk about Motivity. Motivity is the first intervention management platform, which means we're able to cover your needs when it comes to data collection and clinical documentation to scheduling, billing, and beyond. What I love about these webinar series is that what we try to do is look at specific features and look at specific tools from a few different angles, how our customers are utilizing them, the value they're seeing, and how these might make an impact into your organization. And today we are going to be focusing on our dashboards. Before I start to go through an overview of what our dashboards show, what is important to think about is when you don't have access to this information. If you have been in any of our other webinar series, you've seen me utilize this image before. I think it's really impactful and powerful to just show how difficult it can be when you have information in other systems in different forms, even if you have them all within one spreadsheet, but you try to overlay them to identify certain patterns, it can become quite difficult to be able to see the information you need, see the patterns that you need. And that's why it is so important to be able to have access to dashboards to help make you make informed decisions. So what we like to think about is that the dashboards within our system are going to make patterns visible that otherwise might stay hidden in raw data or in separate spreadsheets like we see here. Our dashboards are going to help your operations team connect the metrics and the data that they'll see to real world outcomes. And that might be improved scheduling, improved utilization of hours, improved staff capacity utilization, and then ultimately all of that impacts the access to care. So next, what we'll go through is that product overview, and we're going to spend most of the webinar today just sharing my screen and being able to, again, see what you're able to access on the system. Make sure Zoom popped over. Perfect. As a quick overview of the information on the dashboard, I am just going to talk through it, and then we'll interact with the system in a little bit more depth. Starting at the very top, the first two things we see here is a utilization of our authorizations across patients, and then a capacity consumption summary, which is going to show us a breakdown of staff hours. So the total hours they're scheduled for a week, as well as a breakdown of the services that they're being scheduled for. And we'll walk into that and walk through that in a little bit. The next section you'll see on our dashboard are these alerts, which again, we will interact with in a moment. But what's important to know is that these alerts are based on the compliance nature of the system. So these are going to bring attention to any compliance risks within your organization that your team's going to want to attend to. Below that, we'll look at some of the different tokens and charts within our dashboard. Before we scroll through, what I do want to point out is you have the ability to look at these dashboards across all locations within your organization, or you can start to filter for just specific office locations or sites. This helps you identify patterns across your entire organization, or if you want to see trends and compare across different locations. At a high level, looking at the information we'll see here, up at the top, we're going to be able to see the patients and providers within this specific office. Then we see key information like the projected cost for the month as well as the projected earning. We are in a demo account, so this information will hopefully look different than what you would see in your actual account, but it does help guide and inform you on the decisions you might make. So right off the bat, if I'm seeing that my clinical cost is projected to be higher than my earning, that's going to be something that I'm going to want to take a look at. What do we need to identify within our budget to make sure that that is not going to happen within this month or across different months? What's our average days to bill? We break down outstanding amount, both the total as well as the different funding types. So you can see if you're noticing that outstanding balance is always with one specific, Medicaid versus commercial payers, being able to look at those types of trends. That's going to help you also make sure you do have a diversified funder landscape so that you can have the cash flow that you need to keep your doors open. We can look at the average days to collect, the cost for rendered services, as well as the projected earnings. Scrolling down, the top two here are going to show us hours and month as well as a timeline of hours. On the left side, we can see the hours in the month, so what's been canceled, what's already been rendered, as well as what's been scheduled. Now we're about halfway through the month, so you might look at this chart in a couple ways to say, well, it's great that we have all of these hours that are being scheduled for and make sure that we're proactively scheduling time, but maybe I would want to see more hours rendered in this month because we are about halfway through. To the right of that, I see the timeline of hours. Ideally, yours would be a reverse in an actual account versus our demo account, but I can see the total hours scheduled versus the total hours competed. Still, it's going to be really helpful for me to see if there are certain trends where what we were expecting to have scheduled didn't happen in terms of compared to what was completed. Are we noticing that over certain months, maybe it's a school break or maybe it's a holiday season, and so we're seeing that there's a comparison. Some organizations, it also helps them to make decisions on should there just be days where they're closed over the holidays because they're noticing that a lot of those appointments are getting scheduled, and so maybe they're having to pay staff admin time to make up for those cancellations, or you have people coming in that are not actually not actually meeting with clients for services, and so that can cause financial strain. So determining some of those patterns becomes helpful. You can clearly tell that the holiday time frame is on my mind right now, and those are things that these dashboards can help inform. Now, because we're looking at one office, we're going to see all the employees within that specific office, but we could compare across offices as needed. We can see a breakdown of cost and revenue across months, and we'll see a few different pieces of information. What's the cost in the month versus what was billed, what was expected. Our top contracts for last month, the one on the right, I also really appreciate in terms of its utilization. So a monthly service comparison. On the bottom, we see what services it's comparing across each month. Now, almost always, or probably always, you're going to see 5.3 is going to be scheduled and billed higher than your other services, but it also helps you determine, is enough 5.3 being scheduled and billed? Is enough 5.2? Again, that's going to be a smaller amount, what you're going to see on this chart compared to 5.3 or 5.5, but are you able to actually go in and schedule and render those reassessment hours that we do get authorized for? Additionally, are you noticing that 5.1, so are certain, maybe it's intakes or maybe it's reauthorizations, you're seeing a pattern of when those hours are being utilized. So it just helps you identify, even if you've started another service line, are you seeing how that's being utilized across months? Are you seeing that gradually you're increasing the number of hours that is being scheduled and utilized? Are you not noticing a pattern there? So those become important in terms of different decisions you might need to make within your organization or things that you might want to bring your attention to. Finally, we can see recent payments as well as payer collection aging. So we saw that before, the outstanding amount was broken down by funding type. Now we can actually see across our payers what is happening for aging. I won't get into too much detail, but of course, with the government shutdown, we see that different payers are delayed in their payments. But even beyond that, you might want to bring your attention to information here that's going to be relevant to see, are there patterns in the time frame in which we're receiving remittance from our payers. Now that we've seen this overview, I actually want to dive in to the aspects of the system to start to show you how this data drives informed decision making. Up at the top here, I mentioned our authorization utilization summary. As stated, this gives you a breakdown of the hours utilized for these authorizations across your patients. In the red, we're able to see available hours. In the blue, we can see scheduled hours. And then in the green, we're going to see rendered hours. Same as with our other dashboards, I can also look across all my locations or a specific location. But this is informing me on how well we're utilizing the authorizations that we have requested for. So what does this help in terms of decision making? Some questions that you might ask yourself or some decisions you might make based on this information is, do we have recurring blocks and does that improve the utilization of authorizations? Do we want BCBA scheduling for themselves, or are we finding that authorizations aren't being utilized to their full capacity if we have BCBAs handling their schedules versus a scheduling or operations team? And then finally, how can you coach teams on when utilization dips below a certain threshold? So, are there certain patterns you're noticing where your team doesn't really have an insight into how well they're utilizing these authorizations? What steps can you take to make sure they can see what's being utilized, what isn't, what's being left on the table? All of these things become impactful in terms of the hours the patients are receiving for care. And also, if your funders are consistently seeing that you're requesting for this amount of hours, but you're not utilizing them. So beyond just what this dashboard information tells me, I can actually start to take steps based on the information I'm seeing here. So if we look at this patient and we notice that there's a lot of red, so there's a lot of available hours, again, being in a demo account. But what I can see, again, there is a lot of red hours. So what might I want to do to identify what's happening with this patient where we can make sure that we're seeing more blue, we're seeing more proactive measures in terms of the schedule? When I look at this information here, I can redirect to my patient or I can go back to my scheduler. In this case, I want to go to the scheduler and I want to examine how is she currently being scheduled for where we aren't seeing uh, great utilization of her off. What you'll see here at the patient level on our page is this green is indicating all rendered services. Red is informing me of a cancellation and blue is showing me scheduled services. So if I look at this week, it looks like her schedule is a little bit wonky. I do see two appointments around a similar time. Maybe if I look at last week, I'm seeing that we have two services that still haven't been rendered, but it looks like at least there's some pattern for scheduling. But if I go out to next week, I can see that there's nothing been scheduled yet. So we aren't proactively scheduling it. We aren't setting those recurring sessions, which will make a better use of our authorization. So because of this data I've seen on my dashboard, I can now come in and make a decision that's informing me that I want to make better utilization of, I want to use or utilize this authorization more effectively. So I'm going to select the authorization I want to schedule for, select my location I'm scheduling for. Now, our smart scheduling tools are going to help guide you on how much of an authorization has been consumed across this week, as well as what's remaining to make sure we're never over scheduling. On the left side, it also showing me compliant providers. I can also see a non-compliant provider, but that is somebody who's previously worked with her. And then I can make my schedule from here as simply by select recurring. Maybe I want to make sure we're scheduling a 2-hour appointment. And I want to look at scheduling on Mondays, Wednesdays, and Fridays when my client and my provider are available. When I set this recurring schedule, I can either use my authorization hours, I can use my authorization end date, or I can just go to a specific date. Maybe I just know that this works through the end of the month. As I add my schedule, we'll see these appointments creating live. And any appointments that cannot be created, maybe for example, there was a blackout date, especially with a holiday, but now I have these recurring schedules set. And if I go back to my dashboard, we'll filter by location. We can see that we've improved utilization and scheduled that out. Because we only scheduled for a week, it's not going to show us a major bump. But if we did schedule through the authorization end date, now we're going to see the significant change in the utilization of our authorization. And that's the key to the information within our dashboard. It's not just showing you information and showing you trends, it's helping you make decisions and allowing you to do it right within the system so you can take action in the moment. The other key metric on the top of our screen here is the capacity consumption summary, and this helps inform you on how your staff are being scheduled. It's similar in working through decisions on should our staff be scheduling for themselves? Should we be setting recurring schedules? Are we noticing that BCBAs are only billing for 5/5 and we want to see an improvement in how they're billing for 5/6? Are they able to set those recurring 5/6 schedules? So all things like that become really important, and this summary allows you to do that in quick and real time. So I can look by service type. So if I want to look at all of my services, which in the examples I provided, I want to see a breakdown of how, in this case, my BCBAs are scheduling. I can see both what's been scheduled and rendered, and maybe I just want to look at BCBAs in this example. What I'm able to see up at the top here is the total. This is also really helpful if you have billable requirements for your team. Maybe they're supposed to bill 25 to 30 hours per week. You can quickly see, is my team meeting their billable requirement? Alternatively, if you have RBTs where you cannot schedule them over a certain amount, maybe they're a part-time RBT and you want to make sure they're not being scheduled maybe over 35 hours as an example, you can quickly see what the total is across technicians. In this case, we're looking at BCBAs, an example of the utility for an RBT. As I start to open this information, I'm able to see what patients they're scheduled for. And again, I can see what services, so 5-3 compared to 5-5. We've only billed an hour of 5-5 and we've billed 5 hours of 5-3. Do you want your BCBAs providing that amount of direct care? Maybe it's a situation where the RBT is sick and so the BCBA is providing a little bit of coverage and makeup. But this allows you at a glance to be able to see information about how your technicians and your clinicians are scheduling. A breakdown across days. Are you noticing that they're heavily scheduling on certain days and they're trying to make up for it towards the end of the week? And so this can guide and help you coach your team on what's going to be the best from a scheduling perspective to make sure you are not over or under scheduling your staff, especially again, if you do have those billable requirements. If you couldn't tell, that's one of my favorite features on the system. As a clinician, it was very difficult for me to identify at a glance how many hours my RBTs were working at any given week, especially if we did have requirements to make sure they were not being overscheduled or alternatively underscheduled. And then also being able to see quickly how well am I scheduling? Am I meeting my own billable requirements? So being able to capture that information quickly, see a breakdown of who they're working with, how many hours, becomes very helpful in a day-to-day review of information. Now moving to the alerts in the system. The alerts are one of the most practical and immediately valuable aspects of our dashboards within Motivity because they move organizations rather from a reactive or troubleshooting mindset to real-time prevention. The dashboards that we just did an overview of are going to give you the bigger picture, but the alerts are really the heartbeat. They're going to make sure that the right people take the right action at the right time, and that makes sure you're keeping both compliance and your cash flow on track. Looking into them, if I click into patient alerts, I see information like my authorizations are expiring, and we have that in certain buckets, so 30, 60, 90 days. This information can also be directly sent out to the clinicians that are working with those specific patients. When I click on any of these alerts, it also gives me a breakdown so I can see the patient, I can see the authorization, and I can direct back to that patient in the system to start to make decisions. Additionally, I can download this information to be able to view it in a report if I need to share it at a clinical meeting or an operations meeting with the team to start to see to make sure, are we moving through these authorizations? Are we requesting them in enough time? Is everybody taking note of when authorizations are expiring to make sure you don't have any lapse in service? The other alerts that become incredibly helpful, we can move into our provider alerts. So these are going to inform you on those compliance risks. So you have providers that are not enrolled, you have providers that are missing information. So these become really important to make sure that you have up-to-date information on these clinicians, RBT, BCBA, OT, SLP, whatever they might be. Do you have all the appropriate paperwork so that when you go to billing, you're not going to receive a denial? You're not having a problem scheduling because these are actually compliant providers to work with those patients. So those are some of those reactive and preventative measures that you can take so that your day-to-day operations run smoothly, and bringing it to you at a dashboard allows you to attend to it as a to-do list. You're taking proactive measures rather than trying to figure out and pull reports at the end of the month to see how many providers did we have that were not compliant. You can instead actually go in to make sure your providers are compliant. One of my favorite alerts on the system is found within our scheduling alert. We hear this time and time again, having problems with in other systems where you might get a denial due to duplicate claim submission or having trouble with your technicians completing session notes. Right here, you can quickly see how many appointments are in those past scheduled states. Is it an appointment that needs to be canceled? Is it an appointment that need to get rendered? And same thing as we saw before, I can actually take action on these alerts in the moment. So here I can see an appointment from 10:30, and maybe from a conversation with this clinician, I know that this should be canceled. I can direct to this specific appointment I can look at the information I need to, and then I can make an informed decision. Whether I need to actually adjust it or if I need to go in and cancel it from here. Let's make a note. We can also see stats on the specific patient, which will help us get information about making sure the appropriate people are informed. But when we go into this appointment itself, we can identify if it was a late cancellation, especially for organizations that require specific patient responsibility when there has been a cancellation. I can add a note here, and then I can enter that late cancellation. I can go right back through my dashboard and start working through that checklist. So it's a checklist or a to-do they're able to work through to make sure that you're taking the measures you need to before anything were to impact billing. If we look at some of our contracting alerts here, we see other alerts both at the top as well as on the bottom to show you different notifications to give you a breakdown. So we have missing compliance requirements or credentialing requirements, locations that need to be added, all things that make sure you're taking those proactive measures to make sure that nothing were to impact billing as you move down the line. Looking back at our dashboards at a glance, it is the interactive nature on our system that makes them so useful to organizations because they're not just able to see at a pulse what is our organizational health, they're able to take action to make sure that they're making decisions on the data that's in front of them. In addition to all the dashboard information you see here, I do want to quickly mention our reports on the system. If you ever needed to see this information at a different level, or again, you needed to bring it to some sort of conversation, you're able to, there's about 70 plus reports on the system that you can configure from there. You'll notice all the information that I can filter on the report and then certain selections that I can make as well. The system will also remember the different selections that I have. So if I go to a specific report, it's automatically saving, either in this case, the date range or the columns I've selected or haven't selected and what I want to include in my report, and I can preview the report as well. So if beyond a dashboard, you see certain information that you need to pull from the system, we're going to allow you to do that in a very customizable and accessible fashion. Those dashboards are really helpful and intuitive to allow you to very quickly see your organizational health. And then if you're ever needing to pull those reports, we're going to make sure you have access to them to use them, whether that's in meetings or being able to start to compare trends that you might be seeing. All right. Going back to my PowerPoint here, we'll scroll through some of the sections we already saw. Please feel free to reach out if you have additional questions, if you want to schedule a demo with us, whether to talk about our dashboards, how they might be useful within your own organization, or some of the other tools within our systems. We're more than happy to talk with you, learn more about your workflows, and see how Motivity might be the solution you need. I hope everybody had a fantastic day. Thanks so much.